So something that people don't talk about is the ethics of aesthetics. Ethics of aesthetics. And this is something that's very important and very near and dear to my heart, because a lot of times patients will come in to see me and they are overcorrected or overfilled. And I think the industry gets a really bad name because as a medical provider, you have to know when to say when. You have to know when to say no. You have to know when to make alternative suggestions. And so as a medical provider, you have to know that it's not about the money, it's about outcomes that are safe and effective, and then the money will come. But if you are always saying yes to patients that they want something, but it's not appropriate for them, that's when there is no ethics in aesthetics. And so I think we need to kind of take a step back and always know that it is okay to tell a patient that this is not appropriate for you, or I am a solutions-based business, and or if you have a problem, I'm going to offer a solution, but it might not be exactly what you think you should have. And so I think it's also important to not oversell. If we can't solve something non-surgically, I think it's very appropriate to refer the patient out. So get a group of network of physicians or plastic surgeons that you can refer patients out to, because a lot of times we overpromise in this business. And so if it can't be done, then I'm going to refer them out, because it just doesn't make sense to me to try to oversell a procedure when the results just aren't going to be there. An example of this is during a consultation, if a patient comes in and says they want this, then that is a lower facelift. So we're going to refer them out. But if they are wanting just a little bit of a lift, maybe 60 to 70%, then there are usually non-surgical options that we can offer in our practice based on their anatomy and their bony structure. So I think it's important to obviously know parameters as an injector. And although we are really cool people and do really good work, we also have to know what's outside of what we should be doing as not being plastic surgeons.